BVSc MVPHM as the head of Companion Animal Campaign Southeast Asia from 4Paws International. The time is yours. Thank you.
Hi everyone, thank you for the introduction. My name is Karanvir Kukreja and I'd like to thank you all for being here today. I also would like to thank the organizers and the hosts for giving me the chance to speak and for their hard work in bringing all of us together for this. Huge thanks to Jakarta Animal Aid Network and our local team for getting this done at a pretty quick notice. So my name is Karanvir Kukreja. I head 4Paws' campaigns on companion animals in Southeast Asia. Today, I'll be speaking about One Health and One Welfare. Understanding and using these approaches is incredibly important for us, not just in improving animal welfare and health, but also in human welfare and health and sustaining a sustainable future. Most of us are here to consider the wealth and health of animals as a priority, but I'd like to talk a bit more about how this is important for our health and the welfare of us and our planet. Next slide, please. I'll just go ahead. Yeah. So I'll just give you a quick outline of our talk today. I'll be giving a bit of an overview and introduction of the increasing importance of animals in human disease, the definitions of One Health and One Welfare, how they are related and why they are important. I'll also be touching upon these topics in relation to the dog and cat meat trade, and also some ideas for us to consider going forward. Next slide, please. So there is a complex and multifactorial relationship between humans, animals, and the environment. This is not a new concept. It's been known for at least 200 years. We've seen multiple times over the past few years how interactions between these groups has led to effects on human and animal health and welfare. The concept of interconnectedness between these areas and the importance of addressing these together is recognized by leading authorities. We've heard mention of the quadripartite, that's WHO, FAO, WOA, and the UN Environment Program that joined recently, as well as the government of Indonesia. I believe we have someone here from a One Health collaborating center too. It's really important to note that 70% of emerging diseases have zoonotic origins. Now, over the past few decades, with the changes in practices in how we deal with animals and the environment, intensification of farming, deforestation, changes in land use, larger and more extensive trade, the effects of climate change, many others, we've seen an increased frequency in the emergence of diseases. So that diagram below, it's quite simplified, but you'll notice that that's over the last 100 years. It shows us some major zoonotic disease outbreaks over the 20th and 21st century. Now you notice as you go from the left to the right, we're getting more and more zoonotic diseases coming to us, and you can see a consistent pattern there. And unless we make a change, we're going to get more and more of these until the planet can't take it anymore. Next slide, please. This is another diagram that outlines known pandemics from the 1500s. So the ones in gray are confirmed zoonotic origin. You can see the majority are gray. What you'll note here is, again, towards the right, we have a very tight grouping of diseases that includes COVID-19. So this is just diseases that have occurred in the past 2 to 3 decades. The COVID-19 pandemic, it's an example of something that very likely emerged from animals. It's not considered an emergency of international concern any longer, but I think we can all still remember the devastation, how it affected all our lives, and we really need to work together to reduce the chances of that happening in the future. Now, live markets seen throughout the world, they do provide access to income and food security to many, but they also present an example of where interactions between people, animals, and the environment have led to disease emergence, and the massive networks that they form part of also contribute to the spread. Ultimately, for people to go ahead and only consider our needs without considering those of those of animals and of the environment is misguided. Next slide, please. So One Health, in essence, is an approach. The approach is that stakeholders in different sectors and disciplines recognize the interconnectedness of people, animals, and the environment, and work together at different levels to achieve optimal health outcomes. So last year, the One Health high-level expert panel, that's comprised of experts from different scientific and policy fields from all over the world, including an expert from Indonesia. They created a new operational definition of One Health considering the COVID-19 pandemic and how it's really brought One Health to the forefront. So I'm going to read it out here. It's One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent. Now, this definition has been endorsed by the quadripartite. It's being used as guidance for a One Health preparation strategy, which is really key to preventing or at least delaying the next pandemic. And it's also as part of building our capacity for preventing that and responding to that. Next slide, please. Won't spend too much time on this one, but this diagram gives an overview and illustration of the definition. The aim is, again, for all these different sectors on the left, and sectors and disciplines at all these different levels, national, subnational, provincial, to work together with society for optimal One Health outcomes. Healthy ecosystems, healthy animals, healthy humans. Next slide, please. Now, I'd now like to go into One Welfare, and I'm going to start out with reading the official definition. It's worth going through that. So One Welfare serves to highlight the interconnections between animal welfare, human well-being, and the environment. It fosters transdisciplinary collaboration to improve human and animal welfare internationally. One Welfare also helps to promote key global objectives such as supporting food security, sustainability, reducing human suffering, and improving productivity within the farming sector through a better understanding of the value of high welfare standards. Now, One Welfare really emphasizes the importance of recognizing that there's a strong and tangible connection between human well-being and the welfare of animals, and as well as biodiversity and a healthy environment. So One Welfare is a much newer concept than One Health. It only started being discussed a few years ago. What welfare does is, while it considers health, and health is a big part of it, it also looks at human and animal welfare and well-being too. Health is still a very important part. What it does is it adds a new dimension to One Health. So it takes on broader considerations outlined in the next diagram that I'll show. This aims to allow us to improve collaboration, come up with new solutions, and aim for more sustainable progress. It's really important. One Welfare recognizes that all parts of the system are connected, and a change in one part can lead to a positive or negative change in another part. So just to explain the photos on the left, they're taken of the dog meat trade and live markets. In the top photo, one can see cats being drowned in a lake. Below that one, you can see a slaughterhouse in Cambodia, a drowning pit for dogs. There's poor sanitation, including of the surroundings. In the bottom right, you can see the waste from a live market here in Indonesia. So you have all these waste products coming. They're in close proximity to water sources, to the environment, and that's something that also has to be considered. What are we doing to our environment? What pathogens are we putting out? So that's something to consider. Now, next slide, please. So I'm not going to go through all those aspects, but there are many, many aspects to consider in One Welfare. So there's an umbrella there. Feel free to look at it later, but one example I can give is, what is the relationship between animal and human abuse? That's something that has to be considered. How can trying to prevent one help to prevent the other? How can this then be related to improved mental health of those involved and those adjacent to the issue? Then going next after that, I think we can all agree mental health is linked to physical health. So what effects can an intervention here have on human health? How can we optimize these outcomes? How can we capitalize on them? How can improved individual health lead to a broader outcome? Improved public health, improved community support, a sense of togetherness, and hence a more sustainable future. So just for that example, that requires, say, considering that and designing an intervention for that really requires inputs from several different sectors, from us, generally animal health professionals, to educate and advocate for higher animal welfare, doctors and psychologists to consider the human welfare and how we could get through on that side, experts in policy to see what interventions can be designed on a policy basis, law enforcement, community organizers, etc. I realize that this sounds really complex, but it's really important to consider. I think someone mentioned slaughter earlier. Now, I think it's quite established that violence can have negative mental and societal effects. So for example, if someone's in the proximity of slaughter, what can we do to minimize the effects of the violence on that person? Because if someone's exposed to violence all the time, you're increasing the chance of them tolerating or even being involved in violence. Or there's a direct relation between improved animal welfare and improved health. Stressed animals in a poor welfare condition, they're more likely to excrete pathogens. This could lead to the emergence of new pathogens. Animal-assisted therapy interventions where you have dogs and cats, and Four Paws often uses rescue dogs. They can improve the welfare of animals and humans and can have wide-reaching effects. All right, can we go to the next slide, please? So now I've gone through One Health and One Welfare, and there are differences, but they do complement each other. While One Health is more established and well-known, One Welfare can be considered to extend One Health approaches and strengthen them by ensuring that problems are looked at from more angles with more expertise. With these ideas, we may be able to apply more effective interventions and even prevention strategies. Another example of where this could help is, for example, if you were to design an intervention only targeted to improving animal health. For example, vaccinating all animals destined for a market, but ignoring their welfare. Poor welfare in animals will lead to poor health. That will lead to a lower likelihood of vaccine effectiveness, and that will harm the effectiveness of your whole initiative. Having a holistic view really increases your chances of success. Next slide, please. As Four Paws and several of our partners here work on the dog and cat meat trade, I'd like to touch upon the trade and its One Health and One Welfare aspects. It's well accepted that the trade is rife with massive animal welfare issues. There have been multiple cases of rabies directly linked to the trade. There's been documentation showing its negative effects on eradication of rabies. As mentioned earlier, immunocompromised animals in the trade also leads to an increased risk of pathogen emergence and transmission. We have seen incidents of violence and societal disruption related to the trade. This is particularly seen when people try to stop their pets being stolen and they want to protect their pets. You have had incidents of death here. The police have to get involved. It's a threat to societal order. Children witness this violent trade. I think some of those photos which were taken by the Dog Meat Free Indonesia Coalition, there were children there in the markets. And the environmental damage from the trade, which I mentioned earlier, is obvious. Addressing the risks of the dog and cat meat trade must be looked through this One Health, One Welfare lens. Next slide, please. Again, I'd like to reiterate, if we focus on just one aspect, we lose the chance to find crucial interventions. If we bring together different disciplines, we can find new solutions. So now, if you bring all these disciplines, you can make a stronger case for resources to be invested into interventions to improve animal health and welfare, because you can show benefits beyond just animal health, beyond animal welfare. Having several different aspects can lead to innovation. Having someone from a new discipline can bring a new way of thinking and new ideas. There's also pressing issues where a One Health, One Welfare approach can help. One is antimicrobial resistance. It was recently predicted that if it's left unchecked, by 2050, it will kill 10 million people a year. One prominent vet I know said at a conference, the next antimicrobial resistance bug could kill most of the people in this room. We can be fairly sure that the use of antimicrobials in food-producing animals has contributed to the development of these superbugs in humans. Use of antimicrobials such as growth promotants increases the risk of this, and there needs to be really a concerted effort to study this, to track the use of antimicrobials, their benefits for animals both in health and welfare, and the potential consequences. And then using that, we can understand what we can do for the maximal positive impacts for everyone. Next slide, please, my last slide. So for decades, we've made efforts and spoken about preventing the next pandemic. However, we really need to make more of an effort by considering a holistic approach, encapsulating one health and one welfare. One can look at it this way. Say compare pandemics. So your house keeps on getting flooded. You might be able to fix it the first time with some towels, although that'll take a lot of effort. Maybe after the first time, you get a mop and a bucket, and you fix it, but then if it keeps on happening, maybe you can get a pump, and maybe you can get a bigger pump. But if you get all these floods happening again and again in your house, you're damaging your walls, your floors, your foundations, and this could even be affecting your neighbors. How much bigger can your pump be? It makes more sense to find out how the water is getting in, what is causing the water to get in, and taking measures to stop that. And really to evaluate all the aspects to make sure that this doesn't happen again and that we're protected. The world has taken little steps, which are very necessary. Everything starts with small steps, but we need to stick to this. The danger right now is as people forget the pandemic, things will go back to the way they were. One health and one welfare is largely based on the fact that everything on our planet is linked. It's time for big changes, and to change our mindset, we need to find and implement these changes. Thank you.